The gut, especially the large bowel, is a dynamic organ with a lot of living organisms within it. There is a world out there. It is affected by infections, inflammations, polyposis, as well as cancers. The next 2 minutes I'll talk about the inflammatory bowel disorders that affect the large bowel. We are talking about two predominant conditions called as Crohn's colitis and ulcerative colitis. Crohn's colitis is a disease pathology where it affects all the walls of the small bowel as well as the large bowel, in addition to rectum. Ulcerative colitis is a disorder where the inner lining or the mucosa is significantly inflamed. They both present differently when it comes to presentation, as well as the pathological features are slightly different. Crohn's, as informed, involves the whole of the bowel wall compared to ulcerative colitis, which only involves the mucosa. Crohn's can have skip lesions wherein there are areas of normality in the bowel between the disease pathology. However, the ulcerative colitis tends to affect one segment or the whole of the colon. Crohn's disease presents with obstructions, abscesses, fistulae, failure to thrive, etc. Ulcerative colitis presents with abdominal discomfort, bloody diarrhea, distended abdomen, and failure to thrive. When patients present with symptoms related to bloody diarrhea, abdominal pain, failure to thrive, it is important we undertake a thorough history, examine the patient for other systemic features of these inflammatory bowel disorders, put them through investigations, hematological, biochemical, fecal, and radiological investigations, and come at a diagnosis. Once the diagnosis is achieved, it is important to treat them medically and surgically where warranted. The symptoms of inflammatory bowel diseases cause significant disturbance of quality of life to the patients, in addition to failure to thrive and inability to cope with the symptoms. It is therefore very important that we attend to inflammatory bowel disorders in a multidisciplinary setup involving the gastroenterologists as well as the surgeons. Surgeries could include taking a part of the bowel out, very rarely giving them a bag temporarily. And when it comes to ulcerative colitis, if there is inflammation of the whole of the bowel, to take out whole of the bowel and create a reservoir using the small bowel and place it in the pelvis, connecting it to the back passage. We call this formation of an ileoanal pouch anastomosis. You could have temporary bag in the process, which can be reversed at a later date. When one suffers from inflammatory bowel disorders for a long duration, there is a risk of cancers or neoplasia in these patients in the bowel, which needs to be kept in mind. I think inflammatory bowel disorders are becoming more prevalent, or at least the better diagnostics are picking up more inflammatory bowel disorders in India, and it is high time that we start managing these in a multidisciplinary setup. Thank you very much.